President Joe Biden signing executive orders aimed at coronavirus response. Part of Biden's plan is getting 100 million Americans vaccinated in the first 100 days, using the Defense Production Act to try to speed up vaccine production. Now, Amazon executive Dave Clark is offering to help Biden with vaccine distribution, saying this on Biden's first day in office. We are prepared to leverage our operations, IT, and communications capabilities and expertise to assist your administration's vaccination efforts. Our scale allows us to make a meaningful impact immediately. Joining us now to discuss, Chairman and CEO of GeoVax, David Dodd. David, how do we get vaccines out there? Do we need people like or companies like Amazon to take part in that kind of distribution?
I think it could be very beneficial for companies such as Amazon to participate. But trying to achieve such a wide distribution of vaccines, where we've only had 2 million people approximately thus far to receive both doses of the vaccine. So we really only have about 2 million people. If we're going to try and achieve at least 100 million in 100 days, it's going to take everyone who knows a lot about distribution, logistics, all of them working together in concert, and maybe some work in some areas and some work in others. But yes, I think it may very well require groups like Federal Express, Amazon, UPS, others to be able to get this distribution job done.
Yeah, we know that I think Walmart and Starbucks also offering help. 38 million doses have been distributed across the U.S. and only 2.4 million people have been fully vaccinated, at least according to some data so far. But is this a situation where it could be maybe too many cooks in the kitchen kind of thing? How do we keep track of everything if you have more and more people participating?
I think the way we keep track of it and coordinate is have a point person in there. I mean, I always go back to the logistics is what really won World War II. We had so many people working to ship stuff everywhere and get stuff to where it needed to be. It's the same situation now, but we need someone to be able to be the orchestrate, to orchestrate all of this and coordinate it. I think we need a lot of different groups because we have such a diverse nation in terms of geography, in terms of rural versus urban, and all these things in between. So it's going to require all of these other elements, but you're absolutely right. We don't want to trip over each other. So what we need is to have sort of a master plan and certainly a master coordinator.
Would that need to be at the federal level? And how does this affect a company like yours? I mean, I think you're working on a vaccine yourself. Obviously, it's not one of the first 2 or 3, but it looks like, and we're learning this about coronavirus, is that this may not go away for a very, very long time, so there'll be a market for you. So when you look at this, how do you see getting your own vaccine, if you get there, out to all the people that need it?
Well, we'll work through whatever becomes established as the appropriate distribution system. It is going to require additional types of vaccines, multiple types of vaccines. We're seeing the evolving nature of this virus. We're seeing these variants come up. We're now seeing the NIH is calling for new approaches that give a broader-based immune response, basically going after multiple variants or multiple components of the virus, which is the approach we started with. And also we need to achieve greater durability so that we don't require these double doses or multiple doses. That's going to be a real challenge that we have. And then be able to ship something that is not so frozen in a frozen state. The more we can get to something that is non-refrigerated, obviously, the much better and easier to be to handle. And if it's a single dose, the more likely we're going to be able to actually achieve herd immunity faster than we otherwise will.
You know, some of these corporations, I was reading, Amazon amongst them and Starbucks and Walmart that I mentioned, had all really lobbied heavily for their employees to be considered frontline workers and to have access to the vaccine in the initial doses, to be some of the first to be vaccinated as a result. So if that will happen, and if they all come on board to help with the vaccine distribution, do you think that's one of the reasons that they're now offering to help? And what will that do for other companies, small businesses and their employees?
Yeah, I don't think that's the leading reason. I do think it is true when you think about UPS, Federal Express, Amazon. the United Postal Service. I mean, these people are probably highly exposed, or at least potentially highly exposed, and they do need to be vaccinated. Whether or not they are frontline workers, I would question that. I go back to looking at the statistics, the epidemiology. We have a relatively low fatality rate when one looks at COVID-19 versus many other types of diseases. It's greater than seasonal flu, that's for sure, about 10 times. But it is not really that great, and it's highly concentrated into groups that have weakened immune systems, they have comorbidity conditions, or they're elderly. I mean, it's less than 1% among all the groups until you get to age 70, unless someone has underlying conditions or have been exposed to other things. So I really think we need to be doing a much better job of vaccinating people who are, first of all, the medical workers on the front lines, people who care for people, and then also the people who are in nursing homes, the elderly, those with comorbid. And I think then somewhere along the line, we can certainly go after these other workers that may be involved in the distribution process. But I think with only 2 million being done now, we're missing too many people that should be already vaccinated.
Yeah. David, we've got about 15 seconds. What's the status of any vaccine you might be working on?
Yeah, we're quite excited. We announced last week we'd received a grant from NIH to accelerate our funding, and I think that just further underscores that the government is continuing to look for technologies that can give you a much broader immune response, single dose, and high durability. We won't be there as fast. These others are out there now, and we need them now. But when we do come out there, we believe we'll have certain attributes that will give us a very good position in the marketplace.
Okay, very good. That sounds exciting, and congratulations, and thanks for sharing it with us, David.